Friends, a very common question I get asked by patients is what's the best way to control sweating? Now the medical name for sweating is hyperhidrosis. And we generally break down sweating into two forms, primary hyperhidrosis and secondary hyperhidrosis. Primary hyperhidrosis is the most common problem, and that's a condition where, for the most part, it's genetic and it's also focal. So it's usually restricted to a certain anatomic area, whether it's the underarms, whether it's the hands and feet, whether it's your face or scalp. Secondary hyperhidrosis is usually secondary to a disease process, whether it could be an infection like tuberculosis or it could be cancer, and that's generalized. So the primary focus of my question today, the answer to your question, is primary hyperhidrosis, which is genetic in nature, and it usually starts during the teenage years. Usually people are extremely bothered by this. It's not sweating that can easily be controlled. It becomes really more than a lifestyle issue. People are ruining shirts. People are ruining dresses in hot temperatures or in stressful situations. It really shows. And so that's where most patients seek help. Now, we have a protocol for treatment, and in the beginning when it's mild, you can get away with treating yourself with prescription aluminum chloride solutions. And the way these solutions work is they decrease sweating by crystallizing the area of the sweat gland where the sweat cannot come out of the sweat gland. Another topical option is a drug that's been around now for about 5-6 years. It's topical glycopyrolate or Qbrexza. This has a different mechanism of action. These are pads. It's a prescription pad. You basically take the pad out and you can rub the area, whether it's your underarms or hands or feet, with it once a night. It takes about a week or two for it to kick in. It's something that you have to do long term. The most important part about using this, the thing to be careful about is, again, you can't touch your eyes because you're going to get double vision if you do that. Thirdly, a very common thing that we do is we inject Botox. Botox is a drug that's been around for 22 years. It's got multiple indications, both for cosmetic reasons, for wrinkles, but it's got numerous medical indications like hyperhidrosis or sweating and various other things. So the way that works, we actually drop the Botox into a tiny syringe, very, very small needle. I mean, this needle looks like a hair, the size of a hair. That's how thin it is. Not painful at all. We don't even numb you for it. We just do it with ice. And the areas that we want to decrease sweating is we inject with Botox. And the way Botox works is for sweating is we have muscles around each sweat gland that pump the sweat out. And the way Botox works, it decreases the pumping action of those tiny little muscles, these microscopic muscles around your sweat gland. And so lastly, one of my favorite procedures, which I think has changed the sweating treatment game, it's really revolutionized this because it's a long-term solution to sweating, is a device called MirrorDry. MirrorDry in my hands has been around since January of 2012. I was the first physician in the tri-state area to have offered it. I've done more of it than probably any other physician in the New York State area. This technology uses microwave energy. And so the microwave energy is delivered through a handpiece. And this is the handpiece. And basically we treat the underarms with it. And you basically come to the office, we grid the underarms, you come shaven, we put numbing fluid there, and in a very methodical way, we treat each underarm, which takes about half an hour to treat each underarm. Generally, most patients with 2 sessions of MirrorDry get about 80 or 90% long-term or permanent reduction. About 5% of patients who have a really significant hyperhidrosis problem need a 3rd session, but that's a very small minority. Now, I've been doing this procedure for more than 10 years, and I have not seen patients back who've completed really the 2 or the 3 sessions, so it does seem like this procedure really holds up long term in terms of its efficacy. Now, the only caveat to this is the only area that is FDA approved for treatment is the underarms. You cannot treat hands, feet, or face with it. But off-label, I have treated a few patients in the groin area where they have had this problem. I hope this gives you guys a good summary of the available treatments as of today for hyperhidrosis, and you should explore your problem with a doctor that has access to all these treatments so they can really tailor the treatment to your particular needs. It's Dr. Cameron Rockstar signing off.